Hello and a very good afternoon to all of those who are joining me live on the Facebook page of News 9. I'm Neha and a very warm welcome to all of you on the News 9 digital page. Let's face a fact. COVID-19 has taken all of us by surprise and shock. Of course, it has left our lives scattered, countries in distress. When at the initial stages, no one would have really thought the pandemic would turn our lives upside down, which it did. So the pandemic has changed the way we live, affected our mental health in more ways than one can think of. According to a WHO survey, the COVID-19 pandemic has disrupted or halted critical mental health services in 93% of countries worldwide, while the demand for mental health is increasing. The survey of 130 countries provides the first global data showing the devastating impact of COVID-19 on access to mental health services and underscores the urgent need for increased funding. COVID-19 forced various countries, as we all know, to step into lockdown. People were restricted to their homes for months together. Many lost their jobs and many were fighting the fear of contracting the deadly virus or the highly contagious disease. B.N. Gangadhar, director of Bangalore-based National Institute of Mental Health and Neurological Sciences, stated that some people who test positive for coronavirus inflict injuries on themselves because they cannot tolerate disappointment. Now, another psychologist, Prashant Bhimani, said there is a 70% increase in the number of patients suffering from depression and obsessive compulsive disorder due to the coronavirus. People are worried about what will happen to them if they contract the coronavirus. Many psychiatrists also believe that during lockdown, people were emotionally depressed. Talking about mental health in India particularly is a bit difficult task because of the stigma attached to it. We have perhaps seen more people speaking about mental health openly after a famous Bollywood actor died by suicide than we have before. Let's admit it. Now, of course, to talk more about this, to talk about how really COVID-19 has made a huge impact on our mental health, I have with me Dr. Sitesh Roy. Thank you very much, Dr. Roy, for taking out some time for us and speaking to us. Do tell us, sir, in detail how, about the impact of COVID-19 pandemic on the mental health of people. Although there are no expert figures available, but we have seen alarming rise in the number of people slipping into depression or ending their lives.
Certainly, Neha, the impact of COVID-19 has been immense on the mental health of people across the globe. When we look at the effects, there are two ways in which we can see them. One, I call them the direct effects, and then I call them the indirect effects. What we mean by the direct effect is that we have known now for several months that the SARS-CoV-2 virus, through what is called the cribriform plate and the olfactory bulb, where people lose their sense of smell when they get this infection, is one of the routes by which this virus gains access into the brain and what is called the fronto-occipital complex of the brain. We also know that through the blood circulation, this virus enters the brain. We have also found this virus in the cerebrospinal fluid, which circulates around the brain and the spinal cord. So this virus has direct access to the neurological cells in which a variety of different neurotransmitters exist. And because of that, the direct effects of this virus include mood swings, panic anxiety, brain fog, and even to the extent of depression. And certainly the number of cases of depression have been rising. As you rightly said, the number of cases of suicide have increased. And with the limited mental health care access that people have had, this has created a huge problem for a lot of people who are going through this.
Right.
When we look at the indirect effects of this virus, as you rightly said, going into lockdown, going into social isolation, being in fear of life, being in fear of contracting the disease, being in fear of being separated from family, where a person may have to go into isolation or quarantine All of this, along with the financial pressures, all of this, along with the mental and emotional pressures, have certainly taken a toll and created the same symptoms that I just described in terms of anxiety, fear, panic, mood swings, depression, which are really very, very significant issues today for a lot of people.
Right.
And so, between these direct and indirect effects, SARS-CoV-2 has done a lot to the human race lately.
Right. Dr. Sitish, what we have learned till now is that COVID-19 can result in neurological and mental issues. Now, why don't you tell us what are the direct effects of the virus on the brain and nervous system in particular?
Sure. So we have seen everything from what we call an encephalitis, where the actual tissue of the brain gets inflamed. And there have been people who have recovered from the respiratory complications, but then have slipped into the neurological complications of this virus and haven't been able to come off the ventilator, or when they have come out, they've had severe confusional states, delusional states. These are all signs of what is called encephalitis. And when these kind of inflammatory diseases occur, the impact on the brain can sometimes be long-term if it is not recognized. There has been an increase in seizures. The number of people who are having epileptic fits has increased due to this virus. And there have been people who have never had fits in their life, who have developed fits in the midst of this viral infection, or as a consequence of this infection, because of the excitatory effects that it has on the brain neurons, which keep firing without a trigger. When you combine all of this with some of the muscle and neurological fatigue that we have seen amongst people, which is immense to the point where people are not able to function for weeks together even after they recover. We also have seen something called Guillain-Barré syndrome, which is an autoimmune reaction of our immune system to the cells that have gotten infected by the virus in the nervous system. So while the body is fighting off the virus, it accidentally starts fighting off our own nerve cells, affecting the transmission all the way to paralysis. So when we look at all of these complications, we realize that this virus can cause some significant neurological deficits in people who contract it and whom the virus unfortunately affects the system in more than one way.
Right. So, Doctor, there are many things attached to COVID-19. Of course, we'll talk about it later, but the economic part also plays a very crucial role. Many people have lost their jobs, which obviously made a direct impact on their livelihood and prompted them to take the drastic step. What is your word of advice for such individuals?
So I think in any pandemic, Neha, the biggest message is hope. I think that we all have to remember a very key statement which says that this too shall pass. And I think that the hope that we will recover, the hope that we are creative and innovative, and there are ways even during pandemics to work and make a livelihood, and having the patience, and I certainly think having the friend and family network that a person can bank on and fall back on in such times is very, very critical to avoid people from taking a drastic step like taking their life and committing suicide. And I think that seeking the help of mental health professionals, whether it be a psychologist who you may consult even online during such times, or seeing a psychiatrist if there is frank depression, because there are certain therapies that are available.
But then in that case, how do we deal with the stigma? I'm sorry to interrupt you, Dr. Roy, but this case, how do we really deal with the stigma that's attached to it? Let's not talk about mental health, is what one often gets to hear, especially in India.
And I think that this is where people have to realize that a person who gets the virus is not dangerous, is not someone who should be shunned and should be cut off from society and from people. And I think that the fear that has been inculcated into people about the SARS-CoV-2 virus and COVID-19 really needs to be corrected, because we know that 95% people are going to get better after the infection. And so I think that the key here is education of people, education of health professionals, education of the society to know that this virus is not something that should make a person feel restricted, lost, and helpless, which is when all of these problems and the stigma comes in. And also recognizing that mental health is something that is very much treatable, very much manageable, and a person, even with a mental health issue, can get the right help and lead a very normal life. It's just a matter of reaching out and seeking the help, and for friends and family to be the strongest support for these people is the key in this situation.
Right. But doctor, how does one really overcome this situation? COVID-19, as we spoke, has forced most of us to stay inside our houses, which makes it even more difficult for people to cope up. So how do we deal with such situation? You're only confined to four walls. There are many thoughts that come across. Let's admit.
So certainly negative thinking gains a very strong hold on our minds when we are not able to move, when we are not able to work, when we are not able to earn, when we are not able to interact with the people we routinely do. So I think that such tough times really have to make us creative, have to make us realize that there are challenges and we have to go past them. For example, people have been scared to go outside their house, whereas it has been very clearly shown that SARS-CoV-2 is not spread in outdoor environments. A person can go for a walk, for a jog, for a run, get fresh air and sunlight, and that itself will elevate their mood and make them happier and make them more positive towards life. So giving up the fear is step one. The other things that are important is recognizing that in today's day of social media, today's day of internet connectivity, a person can be still quarantined and isolated, but be able to talk to friends, family through all the variety of chats and online platforms that are there. Sharing is caring, and being able to talk to a human being is one of the most amazing ways of healing one's mind and getting one's emotions back on track. And so I think it makes a lot of sense for people to realize that even if you're inside the house, you're physically distancing, you should not be socially distancing, because if you're socially disconnected and if you're socially isolated, that's when these negative thoughts and emotions can really take a very strong hold on a person's mind and make them take some very wrong decisions.
Right.
So I think that creativity, flexibility, openness to interact in more than one ways. I would even say that if someone watches a funny show or a comedy show or watches something that is light-hearted, rather than watching something that is very stressful and intense and creates more negativity, is a simple way to change one's endorphins in the brain, change one's dopamine and serotonin levels in the brain.
Or in this case, music, right kind of music also helps a lot, isn't it?
Immensely. Right kind of music, right kind of movies, feel good stuff is the key. Yoga, pranayam, meditation, very powerful ways to get the mental health back on track. We as India have shown the world the way in these paths, and now is the time in COVID-19 times that we really need to again show the world the way.
Right. Thank you so very much, Dr. Roy, for taking out some time for us and, of course, telling us how important it is to address these issues and how important it is to talk about mental health. There you heard the doctor. These are a few things that you're supposed to do. Go out for a walk, but while you're stepping out of your house, please make sure you're wearing mask. You're wearing it properly, the right way, which is you're covering your nose and you're covering your mouth as well. And make sure you're maintaining social distance as well. Talking helps a lot. And also so you want to change your mood, you can always switch on, you can always watch a comedy show on the television or listen to the right kind of music. I really hope that this video was helpful to you. If at all you like this video, do not forget to subscribe Newsline YouTube, like us on Newsline Instagram, Facebook as well as Twitter. Thank you very much for joining me. Stay safe.